Here's a stark reality check. Hundreds of thousands of New Yorkers are about to lose their health insurance. And it's all tied to a federal funding cut that's sparking fierce debate. The Hochul administration has announced that due to a $7.5 billion reduction in federal funding for New York's Essential Plan, roughly 450,000 people, including an estimated 70,000 on Long Island, will no longer qualify for this critical health insurance program. But here's where it gets controversial. While the state blames federal cuts under the Trump administration, others argue that this is a symptom of broader policy failures. Either way, the impact is undeniable. The Essential Plan, which currently serves about 1.7 million low-income New Yorkers, offers a lifeline with no premiums or deductibles, saving enrollees an estimated $6,100 annually compared to commercial insurance. It's been a game-changer for those earning up to 250% of the federal poverty level. Think a single person making around $39,000, or a family of four at $80,000. But without federal funding, the state is forced to revert to the basic plan, which caps eligibility at 200% of the poverty level, or about $31,300 for an individual and $64,300 for a family of four. That's a significant drop in coverage, and this is the part most people miss. The Essential Plan wasn't just a state initiative. It was almost entirely funded by the federal government, thanks to a waiver secured under the Biden administration. That waiver, which allowed the program to run through 2029, is now in jeopardy. Without it, the state is left scrambling to fill the gap, and many enrollees will be pushed into the private insurance market, likely through Obamacare. But here's the catch. Unlike the Essential Plan, these options often come with deductibles and premiums, which could be unaffordable for many. Governor Kathy Hochul is putting pressure on New York Republicans to push for a 3-year delay on these cuts, arguing if Republicans give a damn about protecting health care for their constituents, they can act right now. Is this a fair demand, or is it political posturing? New York's 7 Republican members of Congress did call for a delay before the federal budget passed, but it wasn't included. Now, the state is left to pick up the pieces. The changes are set to take effect in mid-2026, but the public has until October 10th to comment on the proposed eligibility shifts. For those who lose coverage, the transition won't be easy. Bill Hammond, a health policy analyst, notes that while Obamacare offers subsidized options, they're not as comprehensive as the Essential Plan. So what's the solution? Should the federal government step in? Or is this a state responsibility? And what does this mean for the future of healthcare access in New York? Here's a thought-provoking question for you. Is this a failure of federal policy, state management, or both? Let's keep the conversation going. Share your thoughts in the comments below.